Um, I am a postdoctoral fellow for the CAPE project, which stands for Community Assessment and Education to Promote Behavioral Health Planning and Evaluation. Today, Jessica Tess and I are very happy to present to you our webinar entitled Community Behavioral Health. There's an app for that. So the two of us will take some turns going through lots of information for you about apps. We do like to always acknowledge our project partners, the Substance Abuse and Mental Health Services Administration, as well as the United States Department of Agriculture's National Institute of Food and Agriculture, and the Regional Rural Development Centers, all three of which have made the project possible. So today we are going to start with just a basic overview of some of the research about behavioral health apps, what they've been found useful for. We will talk about some of the benefits and disadvantages of using apps for behavioral health issues, as well as some tips for how to pick an appropriate app, what might help to best fit your needs or a community's needs. And then we have examples of just a few different behavioral health apps. There are many, many out there, and we will give you an introduction to some of those so that you can start looking. So I'll hand it over to Jessica for the research section.
Yeah, thanks, Courtney. And just a quick reminder to all of our participants, if you have any questions or comments along the way, feel free to put them in the chat box. We'll try to be fielding them if you're putting them in while we're still presenting. And of course, we will have time for question and answer at the end. So first, we'd like to talk about what some of the research says on behavioral health apps. And this is a relatively new topic of conversation within peer-reviewed sources, but what we've been able to find about behavioral health apps are all addressing a very specific question or problem, which is that healthcare addressing behavioral health issues is normally pretty costly, and we often have very limited resources in addressing those issues. So in a quick look at the research, we've been able to find that studies have found successful outcomes for the use of smartphone apps in assisting for treatment of a number of behavioral health conditions. And so these are some of the examples. These studies have talked about the use of smartphone apps in addressing suicide, alcoholism, perinatal health, cocaine addiction, smoking addiction, and bipolar disorder and schizophrenia. As just a couple examples. And I should say quickly that for all of these different studies, the outcomes for smartphone apps, like I said, they were successful, they were positive. And so in general, what we are finding that current literature suggests is that internet or smartphone interventions work. In fact, they have similar outcomes as in face-to-face psychotherapy. They tend to be very cost-effective. One issue that is present is that currently the advancement of technological capabilities like smartphone apps as a delivery method for healthcare is outpacing the policies surrounding it, and that's not, I'm sure, a surprise to most people that as it's a very innovative area of experimentation and creation right now. Policies that are getting written around it are lagging behind, and so the creation and application of these smartphone apps in different settings, there isn't a lot of guidance compared to policy around other aspects of healthcare, but hopefully that's going to improve in the future as this isn't going to slow down anytime soon. So and also, of course, like I mentioned, there are still relatively few studies that have been undertaken to study the use of smartphone apps in behavioral health, and so more are needed.
Great. So I will discuss some of the benefits and disadvantages of behavioral health apps. So first, we'll start with some of the benefits. As Jessica mentioned, using behavioral health apps are a way to be able to fill treatment gaps in areas where cell phone service or smartphone service is available, but maybe there are not behavioral health care providers who are able to meet the needs of the population in that area. One benefit of behavioral health apps is that they're easily updatable. And by this, we mean that oftentimes, and many of you who have smartphones may see alerts come up on your phone that, oh, this program needs to be updated. We have a new version available. So that means that the apps are responsive, or the creators are responsive to feedback. They are working on developing apps that are better for the users. So these are easily updatable in that the providers of the app are able to get a new version out to people, unlike some kind of a printed document like a book, where a publisher's not going to send you that fifth edition if you bought the fourth. The developer of an app will alert you and make those available most of the time for free. Using behavioral health apps, they often have a simple design, they're user-friendly, they are meant to be something that would compel people to use them. So they are usually very visual rather than textually based. They, once downloaded, are available anytime, anywhere. Most behavioral health apps are zero to low cost. There is one that we'll cover today that I believe costs $5, but I believe the rest of them are all free. So many of these programs are available with zero cost, which is nice for people who may be with limited financial background or limited financial resources. Behavioral health apps can also draw on a number of features that are available on smartphones. So they can use 3G data plans, they could use Wi-Fi, they could make use of Bluetooth, of the sound and video, voice recorder, camera, all of those features. Not all of them do. Some of them make use of different features, and we'll talk about those as we go on. Another benefit of using behavioral health apps is that it's pretty easy to track progress over time. Several of the apps that we'll be talking about allow for daily updates and will show charts of progress over time of how someone's doing with a number of triggers for behavioral health issues, or tracking their different behavioral health actions and behaviors. So some of the disadvantages of using behavioral health apps. Before you can download an app, you certainly have to have the hardware to be able to do so. So that may be prohibitive for some people. It may be too costly to be able to pay for that smartphone or to be able to pay for that service. There may also be infrastructure limitations. So by this, what we're referring to is the ability for maybe an area to receive cell phone service. So you can't use a smartphone, even if you have one, if there are no towers in the area to provide that service to you. Accessibility may be an issue for people with disabilities. They may not be able to utilize the behavioral health apps in quite the same way. In terms of data privacy, this is a big conversation that I feel we're hearing a lot about now, that people are putting their information into their cell phones, into their smartphones, and they're unsure about where it might be going. So it's possible that there might be some kind of security breach and that information would be made available. So that's one precaution or one disadvantage to using these very technologically intensive apps. HIPAA concerns might also be relevant here. There are a few apps that do allow for individuals to opt in to allow their care provider to see the data that they have input. And that goes along kind of with that data privacy issue. Another disadvantage that Jessica mentioned is that there is this lagging policy, that the policy is following the technology. We're kind of learning and figuring out what policies need to be created. And then additionally, as Jessica mentioned before, there is a limited evidence base. So there is some research available about behavioral health apps, but for many apps, they are not evidence-based. And we'll talk a little bit more about what that means as we go on here.
Sorry, I was on mute. So great. All right. So now that we've talked about the benefits and disadvantages of behavioral health apps, let's say you're convinced to give it a try. You'd like to pick out an app for your use. And so we'd like to now give some tips for doing just that. And I'd like to just mention quickly that a lot of these tips that we're going to talk about next were adapted from the article How to Choose a Good Health App from mdanderson.org. The source is listed down there in case you're interested in looking at the original. So the first thing you should consider if you're going to pick out an app to address behavioral health needs is you should set your expectations. So what are your specific health goals? Are they centered around a specific condition or a specific aspect of behavioral health? That might be substance abuse, it might be mental health, it might be a combination. You should know what you want to address when you want to pick out your app. And so, what are you already doing without apps is another question you should ask yourself. Are you already receiving healthcare within a specific setting? Some of the apps that we've been able to look at are apps that can possibly have your data sent to a clinical setting if that's your choice. Some apps are starting to be set up that way where not only can you be using these apps in a personal environment, but you can share that data across different settings where you are receiving healthcare. That's not always the case, of course, but it's a good idea to ask yourself what sort of needs are you already filling with your wellness strategy, and what can an app possibly fill for you that's not already being addressed, or what can it strengthen? And so with that, what else do you need to accomplish? What else do you need to do to accomplish your health goals? And how can an app help you achieve your health goals? So an app might be a very good option for addressing gaps in your needs, but it might not be. It might be something else that you need to do. And so it's good to sort of set these kinds of expectations for yourself before you decide to actually pick a specific app. So once you've set your expectations, another thing you should do is research some of the developers of some of these apps that are out there. If you're looking at different apps, you should be able to find out who developed the app and how long they have been developing apps. Some of the examples we are going to show you, um, uh, the examples of apps I am referring to, are in fact the first application that a specific company has developed and put out there. So it's not necessarily bad that a company doesn't have a long history of developing apps, but it's good to know the background of the developer and what their goals are as a company or as an organization. It's good to have that information. And so, have any health professionals been consulted in the development of the app? Hopefully, this is information you can find out when developers are marketing their app. They're going to want to put out this information because hopefully it will make it more compelling to you as a user. Have any reputable hospitals or health organizations endorsed the app? A few examples we're going to give do have endorsements and others do not. And so it's good to know that. Here at CAPE, we don't want to only encourage the use of well-established tools. We're encouraging of innovation, but you should know what sort of situation you're walking into. I see a quick question from Kelly that I want to address. Are we able to attain any, is it meant to be census for this webinar?
CEUs. No, we have not set that up, Kelly, but thanks for the question.
Okay, great. Moving on, choose apps that use evidence-based strategies. You're likely going to have the most success with some of these apps. So I introduced a couple of studies from our literature section that talked about specific apps addressing specific conditions. And so if you can find those evidence-based information for different apps, all the better. And so we give a brief definition of what you can consider evidence-based. Something that is peer-reviewed research has shown that this method is effective in reducing or eliminating symptoms of problems associated with behavioral health issues. And some of the features that are present in evidence-based apps have been seen to be that those that are self-monitoring, that set goals, that give cues or push notifications, that encourage or provide social support, and also those that provide rewards. So those are a couple of things you can be looking for that you can know are evidence-based when you're looking at different apps. Most apps, and in fact all apps, should have some sort of form of reviews that you can go through and see what other people have to say about using the app. So many of these apps are available through app stores, whether that's iTunes or Google Play, and so they should have plenty of reviews to look through. You can also search online for information and reviews about the app that might be available through independent websites and blogs that are interested in the type of apps that you're looking at and want to give their opinion. You may also look at reviews indicating long-term use of the app. This will be more difficult with apps that are brand new, but apps that have been out there a while should give a range of reviews from users. Many people will talk about their immediate experience, but others will give their long-term experience with the app, and that's useful for you if it's an app that you do want to use over the long term. And of course that's encouraged since behavioral health habits don't change overnight. um, and so within these reviews, you should look for what are users noting as the benefits or pitfalls of the app. In this screenshot, we give an example for a specific app. You can see it has pretty good reviews. It's got mostly 4 and 5-star reviews, and people are giving their comments on the side. One other thing I want to mention about reviews is that they can be great for troubleshooting. As we mentioned, oftentimes with software, companies will put out updates for software, and the reason they do this is to make the software better. They've noticed glitches or issues that they want to improve, and so they've been able to do that and release a new version. But oftentimes reviewers are pretty good about putting out this information too when it comes to minor glitches with using an app. So say you're having some sort of small issue and you'll go to reviews and someone will say, oh, I just had to delete and reinstall the app and then it worked fine. Or they might say I had to call the organization or the developer and get some troubleshooting from them. Um, Hopefully you will choose an app that doesn't have a lot of these problems, but as we know, Murphy's Law, if technology is going to have a problem, it often will. And so reviews can be a great resource for both assessing the usefulness of an app for yourself and for troubleshooting when you are starting to use the app. One other thing we'd like to encourage in our tips is to test several types of apps before you commit to one specifically. So a few questions you can ask yourself when you're testing a specific app is it user friendly? So in terms of navigating the app, do you feel like this is an easy process? Are you experiencing frustration? Does it is it straightforward, or do you have to really mess around a while before you can understand how to use it properly? Is the app convenient to use? And so this might overlap somewhat with user friendliness, but in other ways it may not. And so when it comes to how convenient the app is, so is this an app that you can use on any type of service, or does it require you to use Wi-Fi specifically in order to be using the app? These are questions to ask yourself because depending on how user-friendly and convenient the app will be, will likely decide how often you will use it. And so we know with behavioral health, habits take some time to change and develop, and so you want an app that's going to, you know, be readily available for you to use conveniently over the long term. Another question to ask yourself is, are you able to use the app as recommended? Usually a developer has specific intentions for how this app will be used, and can you do so? You may also ask yourself, what do you like about the app and what do you dislike about the app? Of course, with certain apps, even if they are user-friendly and convenient, whether you're going to use them may come down to your specific likes or dislikes. Do you very much like using charts, and so this app doesn't provide you with enough of them to keep your interest, or something like that? It might come down to your specific likes. Lastly, we'd like to talk about some red flags you should keep an eye out for when you're testing different types of apps. Be wary of apps that make promises of big results that are going to happen fast. Um, Likely, these are false promises, since, as we've said, and research has established, habits take time to change and develop. And so, something that's going to promise something too fast is likely not going to actually deliver something that's going to be long term. Um, you should also look at costs. So when we looked through a lot of potential behavioral health apps, most of them were free or very low cost. And so if you find an app that is $50, we would consider that a red flag. Why is it costing that much? There might be very good reasons, but you want to make sure that um, you know you're not going to pay $50 for a service that you very well could get from a different app developer for 5 or even free. As we mentioned before, it's not always a bad thing, but you should look at the experience of the developer, and if they seem to have a lack of experience, you should do more research into that developer to make sure that you're making a good choice with their app. Low user ratings should obviously be a red flag. If many people are having a negative experience with an app, you should reconsider trying it out and try to avoid frustration. There are likely other apps out there that will get at the same needs you're trying to address. And so this goes hand in hand with poor user experience. If the app experiences a lot of glitches, a lot of problems, then that might be a sign that the app doesn't have enough people power behind the maintenance of the app or something similar. And so, again, you want to avoid frustration. You want an app that's going to be a pleasant experience in helping you address your behavioral health needs. And simply, an app that doesn't do what you want or need. If you want to address a specific condition, let's say anxiety or depression, and you look at different apps and they do address that condition but don't do exactly what you want to do, then don't choose that app. Look for something else that gets at what you'd like to address for yourself. And so with that, I'm going to hand this back over to Courtney for us to get into our examples.
Great. Thanks for the overview with the tips. So the first app that we'll be talking about is called I'm Quit. It is based around addictions, and this is an app that will allow individuals to track their progress over time with regards to different addictions that they may have. The original intent of this app was to be used for alcohol or drug problems. And the original version only allowed for users to track one addiction. So based on user input, the designer has made it possible for people to track more than one addiction. So someone could be inputting information about alcohol, tobacco, caffeine even. Some of the user reviews talked about using this to stop consuming so much caffeine. So the developer is Big Box. This is the first app from this developer. We were unable to find whether there was any backing from any reputable health organizations prior to the webinar, but based on the very positive user reviews for this app, we wanted to include it. And I will make a brief disclaimer about the number of installs that are listed. This is from the Google Play Store, so if it's possible that someone could download this from iTunes, it's not going to include those numbers. So I would say that the number of installs that we are including on all of these example apps are conservative estimates. So the features of this app, it can trace addictions, you can switch between them easily, record your progress very easily. So you see this screenshot over here on the left, and it shows how long someone has been good, meaning how long have you not engaged in that activity? How long have you been abstaining from smoking cigarettes? So there's the gauge on the left, which is a pretty compelling graphic, and it you can see that there is a little thing down here. It says record in months, days, hours, minutes, and shows so what's the longest period of time you were able to go without using this particular substance, whatever it may be. And Wanda has a question about whether you'll be able to get a copy of the presentation to have links and information. Jessica did respond, but the answer is yes, we will have this recording and the PowerPoint slide posted on the healthbench.info website, as Jessica mentioned, under the webinar tab. So the I'm Quit app will also give an overview of improvement with different types of charts. It's fairly easy to edit or delete history. You can share your success with friends, and it gives you encouraging messages as you're trying to stop using whatever substance it may be. So here's a few more screenshots so you can see what's going on with this app. So it shows over here a calendar view. You can input goals. So the goal to be good for 3 days. So don't use the substance for 3 days here. And then you can see these very exact times of how long someone was good. There is a reason listed here. So this question will pop up. The screen before, I'll go back really quick. You can see this I did button. So when someone has used the substance, they click on the I did button, and this screen will pop up that says why I did. So why did you do this? And people can pick a reason, and then the reason will pop up on this tracking screen. So you might be able to see, well, what are these triggers that are leading someone to make decisions to be using alcohol or drugs, tobacco, caffeine, whatever their substance of choice may be. And then it also will create these different graphs to show that this certain percentage of the time, oh, I'm drinking alcohol because friends have asked me to. So it's a good way for people to be able to track their habits related to addictions and to be able to more visually see what it is that might be influencing them towards making those decisions. And as you can see, this app is flexible. You can add in a new reason. So maybe it wasn't about relaxation or trying to get rid of stress. Maybe it wasn't friends were asking me. Maybe it wasn't that I was bored. Maybe it was some other community activity that felt social pressure rather than being directly asked by a friend or whatever other reason. We have a question. How are app developers or researchers defining success and positive outcomes among their users? For example, some tobacco users may define success by reduction in consumption, while others may define success by quitting tobacco use permanently. Well, this is a very interesting question. Thank you, Stephanie, for that. I don't know that we've seen as much from the developers specifically, but Jessica, do you want to talk about how the researchers have been defining successful or positive outcomes?
Yeah, definitely. And in fact, in one of our examples coming up ahead for apps, I do include a definition of success based on a publication in a journal about the app. So I won't state that now until we're on that example. But there definitely is, I would say, difference between how a developer or a researcher would define success. So in a lot of those different literature sources we discussed at the beginning, they would define success as either very satisfied, I should say in terms of satisfaction of users with the results, or from actual lessening of certain behaviors. So I would actually try to say that people define success differently, and so they may be defining their success based on what a well-known organization has to say, or what their users have to say. And so when it comes to picking out your app, that's definitely something you should research. How are they defining success, and does it match with your own?
Great, thank you. So then we've got our next app here. Jessica, do you want to?
Sorry.
That's
yeah.
okay.
Okay. So when it comes to this app, we've got a little abbreviation. The name, what this stands for is Cognitive Behavioral Therapy Referee. And this app is specifically intended to address anxiety, depression, and issues of low self-esteem. So this is developed by Andrew Arrow. It is their first app in behavioral health that we've been able to find. They've had conservatively up to 500 installs and likely more. We also could not find backing for a specific health-oriented organization behind this app. As you can see, it costs $4.99 or around $5 to install this app, and reviews as of this screenshot um, were positive, but not nearly as positive as the app we presented before. And so that could be due to the nature of this app, so I'm going to explain that briefly. What cognitive behavioral therapy referee allows users to do is track different thoughts that the user has, and ask the user to stop and slow down and evaluate those thoughts to see if they are untrue, unrealistic, or unfair. So let me go forward here. I should say quickly that this is an app that is available at the iTunes Store, and it runs on all iTechnologies, iPhone, iPad, or iPod Touch. However, according to their website here below, it also runs on Android, and so that is another issue of accessibility. If you have hardware specific to iTunes, you may not be able to access Android-specific apps, and the vice versa. So that's another thing to keep in mind. So back to the features of this app. Let's say you're trying to lessen your personal anxiety, depression, or low self-esteem. And so this app asks that when such a thought occurs to you, something related to negative self-talk, that you would record down those thoughts. And so it allows you to do so. You can see in the screenshot an example of someone writing down a thought. I am an idiot. I just introduced myself to a new client and he thought I was terrible at presenting myself. And so then once you have written down a thought in the app, what the app will then ask you to do is to evaluate or reflect on this thought that you've just had and noted down. It allows you to label different types of thoughts. And so you can see in the example here that we're pointing to with our green arrow, the person was able to recognize that this was a thought that they could categorize as conclusion jumping, as well as putting a label on themselves by labeling themselves an idiot. And so the app then asks them to step into the role of a referee and really try to be more objective about this thought that they've had. And so you can see the person wrote down in the role of the referee. They said to themselves, "You are not an idiot. You might have made one minor mistake during the introduction. You don't know what he's thinking. He probably liked you." And so this is the type of you know, self-evaluation that this type of app encourages to you to do for the benefit of lessening your anxiety and low self-esteem. Another feature of this app we'd like to mention is that it is password protected, and so that's good to know, especially when we've looked at different issues about privacy earlier in the presentation. And here's just a couple other screenshots at looking at the capabilities of this app, and this looks like it's specific to what looks like an iPhone. And so you have different options like look and access to look at archived thoughts from your past. So not only can you be dealing with things you've just written down, but you can look back at different thoughts you've written down over time and how effective you've been as a referee for those thoughts. You can search for different thoughts. Maybe you want to look at thoughts based on specific words. Maybe it might be work or a specific setting. So here we have the settings for your passcode, and we have this feedback option here, which comes down to giving feedback toward the developers. So we've got another example here of what we just showed in the previous slide in terms of writing down a thought, giving it different labels, and then being the referee on how true was this thought the person had in the first place. And so as you can see here, when it comes to searching for different archived thoughts, you can do so by text, date, a specific day of the week, maybe Mondays, you're more self-critical than others, or by different forms. And so those are some of the features for this specific app.
Well, I want to just mention one thing very quickly about the CBT referee before we move on to the next one. One of the reasons that the reviews were mixed on this one is that some of the people who downloaded it thought that their thought journal would be sent to a person who was trained in cognitive behavioral therapy to have the referee come back and give them that feedback, but that's not how this app works. So some people were a little bit upset about that, and that's reflected in the reviews, but other people felt like this was very helpful for being able to slow down and think more carefully about the situations they had been in, as well as the interactions they had had, to be able to evaluate themselves a little bit more fairly.
Thanks for mentioning that, Courtney.
Sure. So the next app that we have is Optimism, and it was designed to help with depression, bipolar disorder, anxiety, PTSD. It's a very interesting app. It is available for the iPhone, for iPad. It's also available as a desktop application for Windows or for Mac computers. It has an online web application as well. This was developed by a company called Optimism Apps. This is their main product. They have users in over 80 different countries, and it was one of Healthline's 2014 best bipolar apps. There's currently research going on with this app by George Washington University. So with this app, users can track patterns in their health, and it's a very broad program, and I'll show you a screenshot so you can get a better idea. But it will ask for different symptoms, different activities during the day, different things that people are doing to stay well. Along with mood, quality of sleep, different indicators. And what's interesting about Optimism is that it can also be combined with professional care through the use of this Optimism Clinician Dashboard. So this is one app that can be used where the data can be sent to a care provider who can monitor a number of patients, and on the clinician dashboard, the care provider can set a number of alerts. So if I am looking at all of my patients and I see that someone has been having a mood of lower than 4 for a certain number of days, or maybe just once, then it can prompt an email to be sent to them so that the care provider is able to be in communication and know more about what's going on with the patients on a day-to-day basis. This app is free, which I think is a big plus. So the features of this app, people can chart their moods, they can record different triggers and wellness strategies as well as symptoms. You can create different PDF reports even as a user. You don't have to have the clinician version of it to create different reports. It has custom analysis tools, so you can look through the data and try to establish patterns or look for patterns in your behavior and activity. It also has wellness planning tools, so you can talk about strategies, you can figure out those strategies for well-being and avoiding behavioral health issues. The Optimism app will also allow you to sync across platforms. So if you're using it on an iPhone and you have the program on your computer, it will sync so that you don't have to re-enter all of that information again. And we can see these are a couple of the screenshots, I believe, from the iPhone version. So it's got the slider bars for well-being. So how would you rate your well-being today? How have you coped with whatever's happened today? How would you rate your sleep quality? The amount of sleep you got in the night before, which does go up in 15-minute increments. Exercise, how much exercise did you have today? There's also a question about whether you took medication that was prescribed. You can see there's a slider bar here for healthy meals, amount of water, minimal caffeine and alcohol. And then this is a main menu slide or screenshot here. So there's the core data. Then you can go in and work on the strategies to try to stay well. You can record your triggers, record your symptoms, take any notes that you have about the day. And we have some other screenshots of these charts that are on the side. I know these are a little bit blurry, so we'll show you some more examples here. So this is the desktop version of Optimism, and we will show screenshots that go through most of these buttons at the top. But when you open the program, this is what you'll see. So you can check. You can see some of these things here are checked. So what were the stay well strategies that were used on Thursday, January 8th? So this person got plenty of water, professional support, and they were looking outwards. So this is about psychological perspective. What is your viewpoint about the world at this point? Then what about triggers? So what triggers might be influencing these things? What happened in this day? So there's stress at home is checked, recreational drugs, as well as difficult life changes. And I will note that you can, in the desktop version for Windows, click on these little arrows and indicate a number. So for example, you could put next to caffeine consumption the number 2 to indicate that someone had 2 sodas that day, or 2 coffees. There's also symptoms down here. So what are the symptoms that someone might be experiencing? You can see this view is on main entries, and then if you were to click on the notes, you could add additional notes there. A report from the day will show all of these things in one screen, so it's not quite so overwhelming. Shows all of the stay well strategies, triggers, and symptoms by day. You can also make this show for more than one day. This is one of the interesting analysis tools. So you can select certain days where particular conditions are met. So this might be a good way to analyze behavior for different patterns and try to figure out what you need to know about your own behavior or someone else's behavior to be able to have better outcomes. So you can say things like, well, when the rate your mood today is less than 5, I want to see all of those days, combined with triggers of recreational drugs. So that one is checked or selected, and we run a search and we can see that one day that falls under that is this January 8th. But if there were a number of days that came up, we could look at what other triggers might be going on then and develop a planning strategy. I will note you can add onto this almost I think every category that's available. So you can keep adding on if there are additional things like recreational drug use and caffeine use seem to be going together. You can add both of those. The planning tab includes a number of things. So what are the stay well strategies? You can list the things that will help, overall lifestyle things that someone may choose to follow, triggers related to illnesses, and different behavioral health things. Symptoms, what are the signs that something's not going well, that something is wrong? And by recording them, the people at Optimism think that this might help to recognize at an earlier stage that something is going quite poorly and we need to intervene. Signs that I need help, so this is more about self-reflection, making sure that someone's able to recognize when they would need to go talk to a professional. And then this is a section where someone can put how someone would get help. So what are the steps, the specific steps I would take if I decided that I needed to get professional help. This Optimism app also has a research tab, so this will show you any of the current research that's going on with Optimism. So right now, if you were to click the Optimism, in Optimism, the research button, it would pop this up and it is asking if you would like to be a participant in a study. You can visit the website, and the way that would work is it would sync your data into their database and they would use it for their research purposes. It does not automatically do that though. All right, on to PTSD Coach.
All right, thanks. And so this app was developed by the U.S. Department of Veteran Affairs. It is a free app, and as you can see, it's got pretty great reviews. And so the Veterans Affairs Office has developed over 10 apps related to behavioral health, and they have had many installs, 100,000 plus. And so their backing is the U.S. Department of Veteran Affairs as well as military medicine. And so that is a peer-reviewed journal that in 2014 had to say about this app that participants were very satisfied with PTSD Coach and perceived it moderately to very helpful for PTSD symptoms. And so going back to one of our earlier questions, you can see that user satisfaction is the way that this app chooses to define success for itself. Um, and so, in a nutshell, this app provides information about PTSD. It also provides some self assessment resources and as well as some stress management tools. It's available at the Google Play Store as well as the Veteran Affairs website. It's got some links. You can access it there as well. So here's a quick screenshot of the home. This is likely going to be on an Android device. So as I mentioned, some of the features for this app include providing information on PTSD and treatments of it. You can use some tools through this app for doing some self-screening and tracking your own symptoms. You can also access some convenient tools to try and handle some of the symptoms associated with your PTSD, and you can also look through some direct links to find some extra help. Here are a couple of screenshots that illustrate some of those things I just mentioned. And so in this first screenshot here, we've got a list of different popular questions, some FAQs that you might have about PTSD if you're not very aware about what constitutes PSTD, and what people have to say about it, and that type of thing. And so then right here, we have some self-screening tools. Here's an example of a distress meter rating your own distress on a regular basis on a scale of 1 to 10. So that's one thing you can do for yourself with this app. And then here we've got some nice charts where the user of the app can look at their symptom history over time. And so we see a very positive downward trend in this example that the person's symptoms are lessening over time. And then over here on our Manage tab of the app, we've got some guided relaxation information. So this app is telling the user, hold the muscles in your hands and arms tight and notice some sensations of pulling, discomfort, and tightness. So that's just the beginning of this specific, guided relaxation technique that the app can take you through. And so this is an example of an app that is very well backed, has had a lot of long-term success so far, and a lot of positive user experiences that can encourage you to give this app a chance if you are a person or you know a person who is wishing to address their PTSD symptoms.
Great. So the next app that we have to talk about is called the One Love My Plan, which is an app for domestic violence, or also called relationship violence. This was developed by Mongoose Project, which as a developer, they have also 2 other safety-related apps, although it was developed specifically for the One Love Foundation. And so the One Love Foundation and the Urban Health Institute at Johns Hopkins both funded the development of this app. With this app, users can answer a number of questions about their relationship. It doesn't have to be with a significant other. It could also be with a friend or with a parent, to evaluate the risk of relationship violence. And this has had between 1,000 and 5,000 downloads. There's a caveat to that, which I will explain in just a second. So the features of this app, it is a danger assessment tool. It allows individuals to take a quiz that asks questions about the relationship, so the program will tell them their alert level, how concerned they need to be about the possibility of violence in that relationship. It also allows people to set priorities related to safety, related to those relationships. It provides some safety planning tips, different sources of help, and here's the caveat about the number of downloads. So this program, after you have completed the assessment and exited out of the program, it self-deletes. And the idea with this is that it would maintain confidentiality, because people who are in abusive relationships may not be able to use an app without facing scrutiny, or it may be very risky for them to do so. So the developers have made it so this program will auto-destruct, if you will, but because it is free, people can go and re-download it. So the number of unique installs or downloads is something that we don't know. So here's a couple of screenshots from this app about the relationship. So it's got the number of questions over here. They're just yes, no. So does your partner make you feel guilty for doing things you like to do? Indicate yes or no, and it's just a click. Then it will score your responses to the series of questions. So the response for the questions that were answered in this was that someone was at increased danger. So you can see they make use of this color scheme here to show the level of danger. And then, let's see, I think there's one more. Then there's the priorities for priority setting. So someone's primary priority here is safety. There are other things they can indicate as priorities. And then safety planning, it has a lot of different strategies, like choosing some kind of code word or signal that you can tell others that you're in immediate danger. And you can see there's some more information about violence, talks about the cycle of violence, and then also sources of help. So where can this person turn to try to get help to get out of this situation? Then we are running short on time. We do have some concluding thoughts for you. So we've given you some examples of apps. We've talked a little bit about research with those apps, but what about community behavioral health? What about the idea of community here? So apps could be the basis of a community support group. So if a number of people all had access to the same type of phone, or the different app that could be used on a variety of systems, it could be the basis of a group that would get together once a week or once every other week to talk about different strategies they're using. In this way, it could help to increase social networks and connections. And it could also help to identify events in or attributes of the community that are affecting behavioral health. So if one week all of the members of a group would come together and say, oh, I rated my mood pretty low this week, and these are the things that bothered me, and other people say, hey, those affected me too, then they might be able to think about what is happening in the community that might be leading people to feel those ways or be influencing their behavior. Apps could generate community level data. It would be possible because many of these apps are able to sync up, for example, the optimism with the clinician dashboard. They could be syncing data to a larger database that would allow someone to be monitoring community level data about moods or other triggers, and then it could also help to illuminate widespread community behavioral health needs. So if this data is being collected on a regular basis, it might show something about what people in a particular area are experiencing and what their needs may be.
That's great. So sort of in closing, just to kind of wrap things up, we've talked about how apps can support positive behavioral health outcomes. The data suggests it, and I'm sure more studies are going to continue to be done that will hopefully keep showing these positive outcomes. We've talked about how an app can help you reach your personal goals, or possibly, hopefully in the future, your community level goals. We've talked about how to evaluate apps that you are interested in. And we really hope that the perfect app is going to be the one that really works for you. Just want to mention a couple of resources along with things we've talked about in this webinar. So the first one we've got for you is the National Center for Telehealth and Technology. This is part of the Defense Centers of Excellence for Psychological Health and Traumatic Brain Injury. They're part of the Department of Defense. And they specifically have a newsletter, a quarterly newsletter on research for mHealth apps for behavioral health. So we tried to not duplicate or talk about examples that they've already talked about in their recent issues. So you can go look up that newsletter and read about other behavioral health apps that you might be interested in. We also recommend the Center for Technology and Behavioral Health. And so this is a a multi-level center. They conduct research on behavioral health technology programs and methods. They also have a newsletter. And lastly, we'd like to recommend the Addiction Technology Transfer Center Network. They did a recent telehealth technology webinar. They were established by SAMHSA in 1993, and they communicate information and research findings on new technology about substance abuse to a wide audience, including care providers and communities, and they also have a newsletter. So here's a quick look at our references. As we said, we will make this PowerPoint and the recording of this presentation available on the Health Bench website. And so here's our information for all of that here, as well as for Courtney and myself. Thank you for joining us, and it will take any questions.
Well, thanks, Courtney and Jessica. Well, people maybe take a moment to type. I had a question. Might a community also sort of promote one that's particularly good at an issue that is prevalent in the community? So if they're seeing, indications that a certain condition is on the rise, might they sort of promote this either through providers or through public service announcements or things like that?
I think that's a great idea, that apps could be used once a community has identified a behavioral health need, that if an app seems like the right strategy to use for an intervention, absolutely, that a community could promote one to help lessen that behavior in the community.
Yes, I
or that
totally
behavioral
agree. And
health
in fact,
issue.
it would be very interesting to see the results of something like that done in the community if other types of data have been collected and a community need is very apparent to have people come together and try to use an app as part of their intervention. I think we'd all be very interested in the
So how do people generally kind of come into using these? Is it recommended by a provider, or do they just stumble across it when they're doing searches, or do you have a sense of that?
So one thing I can say right away is that there are definitely a lot more blogs and websites that are evaluating and recommending these types of apps. So Lifehacker would be one that comes to mind that's very popular and used for a wide audience for a lot of different reasons. They're doing a lot of promoting these types of apps because there are more and more good ones coming out. As we saw in the example with the PTSD coach, obviously the Office of Veteran Affairs is really pushing these different apps that they are developing. I cannot speak personally to different clinical environments, although of course it would be great to see something like that. Do you have anything to add?
No, I would only, I guess the only thing I would add is that word of mouth is very powerful. So if one person in a social network finds out about an app and they particularly care for it, they are probably more likely to share that information with their friends and argue that those friends should also use this app. So word of mouth is very powerful. You will occasionally see some ads that self-populate on different websites for apps. For example, one app that we didn't talk about that's available for a few different phone systems and also has a website is the MyFitnessPal, which is for healthy weight and eating. That has that app, or the developers of that app have paid for advertising space, so you might see some ads for different apps But I would say word of mouth or looking at some of these different online reviews, as Jessica mentioned, from Lifehacker. CNET is another website where they often review technology and software, so they may have reviews as
Okay,
well.
thanks. Just I wonder if there's sort of might even be sort of people operating along two parallel tracks where some people are going to a provider and getting a condition sort of diagnosed and using this as a supplement to interactions with a provider, and others might be trying to sort of self-medicate, if you will, through these. So I just wonder if that might kind of set up some people for failure, or do apps, do they kind of say you should also see a provider about this, or is there anything within the software that sort of hints to people that they may need to seek other assistance beyond the app?
Yeah, I think we saw that with a couple of the examples they showed where they'll have tabs for more information or seek help, where they will provide links that do sort of point people towards getting other levels of professional help. I am also curious if it's coming from the other direction. I would be very curious if other healthcare providers are promoting these things as well.
Okay, well, I'm not seeing a lot of questions come through, so I think, and we're at the top of the hour, so great job.
Well, thank you very much. Go ahead.
Thanks
Oh, I was
everybody
just going to
for.
say, I see Wanda Carpenter typing.
Go ahead, Jessica. And thanks everyone for coming today. We really do appreciate your participation. So Wanda says the bipolar or mood disorder app would work well for those who are overweight or have diabetes to realize if emotional problems may cause their issues. That's an interesting point. These apps might help if someone is intending to use them for one particular behavioral health issue. They might help people to realize about more of their actions or more of the things that are influencing other aspects of their health. Absolutely. And again, thanks for your participation today. If there are any other questions or comments, do feel free to contact either Jessica or myself with the contact information you can see on the slide, and we will have the recording and the PowerPoint uploaded.
Yeah, thank you everyone, and feel free to
probably
follow
by the
us
end of the week.
on Twitter at HealthBench or on our Facebook page at the link you see.